Hi, my name is Sophie Quinn, student number N9440241. I'll be doing my video presentation on interprofessional communication. All healthcare professionals work within a team to ensure patient-centered care is achieved, and this is done through effective coordination, collaboration, and most importantly, communication. Interprofessional communication is defined as multiple professions working together, learning from each other to collaborate and increase the quality of care, found in Mitchell-Groves, Mitchell and back in 2010. This is proven to increase patient safety and satisfaction, reduce errors and increase team morale. One of the most crucial times for patient is the transfer of patient care into another team, and this is where most errors occur to safety. It is reported that 7.68 million handovers are done in the hospitals annually, and of this, 1.6 million happen between paramedics and emergency staff, found in Boss, Crowley, Wallace, Patterson and Chibova 2010. Furthermore, this is the area where 2/3 of communication errors occur between healthcare professionals, found in Maricini, Holman Farr, Kemal-Meyer, Piasecki and Sonam 2018. Evidently, this is an imperative aspect of paramedicine which is also extremely high risk, therefore important to research the strategies to improve outcomes. Throughout my degree, there are many realities that I've faced and assumptions that have been challenged. Some of these include day-to-day jobs that paramedics face, but one of the most interesting things I've learned is the impact of communication. Although this sounds like an obvious factor that paramedics must do, experiencing the complexity of the job of working with other professionals has been enlightening. Some of these jobs involve the police, and it was interesting to hear their handover, and I found that they had different priorities that they focused on. I did find this difficult, particularly when there was high mechanism involved or the patient had a high acuity illness. I felt as though there were times when it was unclear who had the bigger responsibility and duty of care for the patient to guarantee their safety. Furthermore, communication at the hospital, I learned, has a huge impact on your patient, and there are many factors that can affect handover due to the nature of the emergency department. I found this particularly evident when handing over patients in resus. There are many people around, however it is hard to know who is the leader and who needs to be writing this down. There are also many distractions in this situation as well. When I initially started, I assumed handovers were for clinical signs and symptoms, but as I progressed throughout my placements, I've realised that they are also an opportunity to advocate for the patient holistically. I am fortunate enough to have been a part of many different types of teams that have helped to develop my communication skills. Firstly, being a part of a GP practice as a receptionist has shown me the importance of open communication through the many parties involved. My role in this job is to pass messages from patients to doctors, and I often have to decipher the actual issue in order to deliver a succinct yet detailed handover. I have also learned how to actively listen when taking handover from a doctor and what questions needed to be asked to ensure I have accurately understood the message. Furthermore, I have been a part of a percussion ensemble, which is yet another type of team that has helped me form my communication skills. This experience has taught me to adapt to different personalities. Working creatively with people can be challenging as they can take things very personally, so being able to adapt to this has taught me to be sensitive in the way that I communicate while still ensuring the crucial message gets across. Whilst these experiences have been invaluable for my communication skills, I still need more practice handing over clinical patients. I have been able to achieve this through placements, however, there are still areas where I need to improve on to avoid the common pitfalls of handover, such as accidental omission of information. The emergency department is a complex environment with many variables, causing it to be a higher risk. It involves many different healthcare professionals and anxious patients with time constraints. As paramedics enter the emergency department, continuity of care must be achieved through the use of handovers, often needing to be done multiple times. It is well established that clinical handovers are crucial for patient safety. However, there are many pitfalls that occur during this time that threaten this. Redley, Botti and Bucknell 2017 discuss the adverse effects of communication between healthcare professionals. They state that each clinician group has their own unique communication patterns that usually do not properly translate across groups and can hinder communication. This is most likely exacerbated by the different priorities for each health professional, as each bring their own perspective and what they think is important. Furthermore, the lack of defined roles and responsibilities has been seen to negatively impact communication. This can lead to inaccurate transfer of care and accountability for the patient. Barriers to communication do also involve the specific environment in the emergency department. So these factors include increased noise, stress levels, the busy environment, and interruptions, which can all lead to errors, found by DeLange, Van Eden, and Holmes 2018. These distractions can cause ineffective listening, leading to misheard information and negative patient outcomes. In the ED, the focus can unfortunately be very task-oriented, which, whilst this is needed, during handover it can be detrimental for the patient. Hovenkamp 2018 reported the frustrations paramedics had when the receiving team in the hospital began cares before listening to handover. This is obviously dependent on the case, as some patients will have a higher acuity and need care straight away, but I feel where possible, handover should be given before anything is started. This can reduce the amount of distractions and interruptions as well. Paramedics also report that they have to state their handover multiple times, which can lead to inconsistencies and omission of information. It is reported by Dawson, King and Grantham 2013 that baseline observations were not being properly handed over and documented. Emergency physicians highlighted this as the most significant communication failure. Reliance on memory to perform a handover instead of documentation can lead to these errors, and as this is the commencement of a patient's hospital journey, can cause huge detrimental effects. These include delay in treatment, lack of recognition of deterioration, medication errors, and misdiagnosis. All health professionals, whether it is paramedics, nurses, doctors, or allied health, need to be able to work within a cohesive team to maintain patient safety and positive outcomes. Therefore, communication skills need to be improved and certain strategies should be implemented. Reflecting on these issues seen in handovers is extremely helpful for myself to start good quality habits. One of the first habits I'm going to implement is ensuring I maintain accuracy and consistency. Therefore, I'm going to be writing down all my handovers and using mnemonics to structure this as well. This will also help to ensure I provide the receiving team with all the information and include baseline observations as well. I will also make sure I do not use abbreviations or acronyms that could be misinterpreted. Rather, be very transparent with the information I'm handing over, as seen in Wilson 2011. Bost et al. 2010 emphasised a need for the merging of health professionals in order to achieve the highest quality of care for a patient. They discuss a shared mental model which has 4 components. These are understanding the technology and equipment used, understanding the roles in the team, knowing the knowledge of how the handover will be accomplished, and finally, respecting each team member's skills, strengths, and limitations. I feel I am able to take these aspects into my practice as I need to understand who is it that I'm handing over to, the team leader, nurse, and doctor, who is scribing, and also understand the limitations of the emergency department to keep that in mind. Additionally, I need to improve my confidence when handing over and to ensure that everyone is ready before I begin using my eye contact. I also want to adopt the habit of asking if there are any questions at the end of handover. I feel this will ensure that the receiving team fully understand the presenting problem, as well give them time to clarify any information as well. As I said earlier, I would like to improve my holistic approach towards patients by ensuring at the end of my handover to add in any social aspects that are impacting the patient's lives as well. This plan that I've got for myself, I will aim to practice for the rest of my placement and continually ask for feedback from my mentors as well as the nurses and doctors that I hand over to. Thank you.